Hi, I am Dr. Santosh Bhatia. I am the director at Vanity Cosmetic Clinic. I also practice at SBS Hospital in Andheri. Today I shall discuss with you regarding a procedure called as a tummy tuck procedure. Now, what is a tummy tuck procedure? Tummy tuck is a procedure in which liposuction is done to remove the fat. Along with that, the excess skin is removed. The muscle, which is called as the rectus muscle, is tightened, after which the entire area is closed, as you can see in this particular patient. So, who is a correct candidate for such a surgery? Patients who have had a history of multiple pregnancies, mostly obviously women in that case, in men who have undergone a massive body weight loss at times, people who have history of muscle divarication or hernia are ideal candidates for such a procedure. Now, what happens during the procedure, before the procedure and after the procedure? So typically before the procedure, when a patient comes in for a consultation, I will examine them, I will check their muscle tone, I will check the amount of excess skin that they have, I will see the amount of fat that they have. Based on that and their desires, I will decide whether they are correct candidates for this procedure or they may not be correct candidates for this procedure. So who is not a correct candidate for this procedure? Patients who have a lot of intra-abdominal fat, especially in men, are not ideal candidates for such procedures. Such patients, I advise them to undergo weight loss with the help of diet, exercise or bariatric surgery, after which they come back to me and then I do a tummy tuck or a body lift procedure. In women, however, after multiple pregnancies and sometimes in a single pregnancy also, the entire muscle stretches and tears, after which one has to do a tummy tuck to tighten the entire muscle. There is no magical way that this muscle is going to go back into position. Hence, we decide we wait for 6 months post the pregnancy and then take a call whether a tummy tuck procedure is required or not. At times, women who undergo this procedure often say that whenever they wear tight clothes or when they wear saris, their entire tummy is completely bulged out and they feel that, and sometimes some patients have even come and told me that people think that they're pregnant again because their muscle is completely torn. Now, so that is the way we assess every patient. We do a few blood tests prior to surgery, we do an X-ray, we do an ECG so that we know that you're fit for this particular surgery. Now, what happens on the day of surgery? Now, on the day of the surgery, I come and I do my markings. That is my GPS systems for me to understand and decide how much I'm going to remove on table, how much I'm going to leave back. I typically begin the procedure. It takes about a good 5 to 6 hours for this particular procedure to be done. I do the liposuction first on the sides. I remove the entire fat from the flank area, after which I do the tummy tuck. I remove the entire extra skin. I tighten the muscle from inside and I close the entire area. The patient is put in a beach chair kind of position for a period of 2 to 3 days in the hospital. So typically patients are admitted from 1 day to 3 days based on their pain threshold levels. Typically this patient or this procedure is not very painful. However, it has a profound tightening effect on the abdomen and some patients may perceive this profound tightening effect as a little discomforting. So this procedure takes 6 hours, as I've already mentioned, after which they are admitted for 1 to 3 days. There are few drains which are kept in the abdomen. This drain is removed again on day 3 to day 5 depending on how much fluid is draining out of in the canister. This patient then typically is expected to bend down and walk, because when they are bending down and walking, it is much easier, the tightness is lesser and it's more comforting for them to walk around with. On day 3 is when I make them wear a pressure garment, which is nothing else but like how most women wear a corset. This helps to reduce the swelling. And patients typically are back to work within a week to 10 days. At times, there are patients who tell me that their tightness has lasted them for 3 weeks also. But again, it's a desired feeling. Now, what can go wrong? Typically, it's a very safe, straightforward and common procedure in India especially. And at times people may complain of some amount of swelling, some amount of irregularity, some amount of asymmetry, some amount of bruising. But these are generally very temporary, and with in the due course of time, all of this subsides. So swelling and bruising can subside from day 7 to day 10, and amount of asymmetry or some amount of irregularity may take even up to 3 months for it to subside. I typically call patients on day 3 of surgery. I call them on day 10 of surgery to remove their stitches in case I put anything from the outside. Mostly I put all the stitches from inside. Then I call them at 1 month, 3 months and 6 months so as to evaluate them. And this is the way the procedure is done. In most patients, we target a minimum of 6 to 8 inches of reduction. Again, I would not promise every patient on that, but as in this patient, as you can see, she has got even a 15-inch reduction. She's gone from a 42-inch waist to a 27-inch waist. So there's a lot of variation in each patient, and hence I would advise a patient to come in, meet me, understand, and I can give them an average of how much or how many inches I can reduce. This is not a weight losing procedure. So when patients come to me saying that I want my weight loss is my main priority, then this is not the correct procedure for them. But patients who come and say, I want to change the shape of my body, I want to change the way I wear my clothes, I want to start wearing crop tops, I want to start wearing bikinis, then this is the perfect procedure for you.